Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Happy Monday and welcome to the Regenerative Medicine Show with Dr. Luis Escobar. I'm your host, Tracy Kawa. You're watching WNN Radio, or you're tuned into 1470 AM on your dial, or you're catching us live on AMP2 TV, Facebook Live, AMP2 TV Productions on Facebook Live. So Dr. Escobar is a practitioner at Pain Care Specialists of Florida. Es el Doctor de los Milagros. Dr. Escobar is a double board certified doctor of anesthesia and pain management. His practice is dedicated to interventional pain management. He has 3 offices in Hollywood, Aventura, and Pembroke Pines. In our series of the Regenerative Medicine Show, we unveil the mysteries behind platelet-rich plasma and stem cell therapy. And this is for regeneration and pain treatment. So let's talk for a minute, once again, to the silent sufferers out there in our listener audience. You or someone you know may be suffering from chronic joint pain in your back, your knees, your elbows, or your wrists. You don't have to go it alone. I want to invite you to join the conversation with the compassionate doctor who cares, the doctor who has done years of research before incorporating PRP and stem cell therapy into his very own practice. Dr. Escobar is your partner in your healthcare journey, helping you step back into your optimum performance and getting you back to your day-to-day activities with freedom and without pain and discomfort. As we speak with Dr. Escobar, remember, you can call in at any time to ask a question or to find out if you are indeed a candidate for PRP and stem cell therapy. Call in to 888-565-1470. So this week, we'll be talking a little bit about what's been reported in the news on stem cell therapy. But first, Dr. Escobar, can you tell us a little bit about what stem cell therapy is?
Absolutely. Thank you, Tracy. Good to be here again. Well, stem cell therapy is the science of regeneration of injuries and of patients. We use platelet-rich plasma and stem cell treatments to regenerate injuries normally. Our bodies have that capability. We have our stem cells in depositories in our body. Pretty much every tissue in our body has stem cells. They're more abundant in the bone marrow and adipose tissues such as fat, and the synovial fluid, the skin, even your teeth have stem cells. When there's any injury that occurs within our bodies, these stem cells are activated and they rush to the area of the injury to try to heal this injury. In some instances, the injury is too severe, or there's other factors that interfere with the normal healing process, and the injury doesn't heal properly or becomes chronic. And in those cases, then we can intervene by helping the body by going to harvest those stem cells from they exist normally in the body, harvest them, separate them from the tissues that are not needed for regeneration, and precisely re-inject them in the tissues that are injured, and then promote the healing process. when we do this, normally there's some stem cells that reach the injured area normally. When we do the harvesting, we're harvesting millions of these cells, millions and millions. To give you an idea, 1 cc of concentrated bone marrow aspirate has over 100 million nucleated cells. So
Wow.
that is a lot of cells.
That's a lot of cells.
And we are injecting several cc's into the injured area. So it's many millions of cells that we put into work.
Isn't that interesting? It's like injecting millions of soldiers back into our bodies, but the soldiers came from our bodies to begin with.
Correct.
Wow.
And not only that, we add the platelet-rich plasma to this, which is the tools that these stem cells are going to use to promote to perform the regeneration. So we take some blood from the patient, again processes in our lab through special equipment and centrifuges, separate the cells that we don't need, keep the ones that we need that promote the healing, mix them with the stem cells, and together inject them precisely via fluoroscopy, which is direct X-ray visualization of the tissues, and or ultrasonography, and that's how we put those cells precisely at the area that is injured.
Interesting. So, how do you know whether to, or how do you determine whether to put the stem cells to inject them into the bone marrow or into the fatty tissue of the body?
No. Those are areas that have stem cells.
So that's
normally.
where you harvest them from.
We harvest them from those areas.
And then you
correct.
inject them directly into the injured site.
After their process, they go exactly at the injured site to promote the healing.
Got it. So it's putting them back into the
Now,
site.
let me just reiterate that these are your own stem cells. I don't mean your own to somebody else. Their
Right.
own patient stem cells. I don't
Right, they're not
want you to.
harvested
I don't
from
want you to be
anywhere
the
else.
donor,
They're
Tracy.
not,
Don't
right,
worry.
They're not, I'm not coming in to donate.
Right.
So they're not harvested from, let's say, embryonic stem cells, a whole other ball game.
Absolutely not. No, embryonic stem cells are known for all the controversy that they caused. And back in President Bush presidency, this research was banned. The embryonic stem cells. There was a lot of controversy. So that developed the interest into the autologous stem cells, and great advances were made. And thanks to American ingenuity, when you
Right.
have something, you create something else.
The invention, mother is the invention of, what is it? Necessity is the mother of invention.
Correct. Couldn't put it better
Right there.
myself. And the fact is that there's many more stem cells that can be obtained from your own body that were obtained from embryonic stem cells. So that was a great thing that happened to this science, and we're taking advantage of all that research.
Taking advantage of all the advances out there to help people. And speaking of a whole other ball game, so you obviously saw in the news that there are 2 additional ball players that are receiving stem cell therapy. So one was Lorenzo Cain from the Royals baseball team, and Steven Strasburg, who's receiving PRP. He's on the Washington Nationals. So I believe that the article I was reading said that Cain had a wrist sprain.
I believe so. He was treated with stem cells for a wrist injury, and Stephen was treated for an elbow injury with PRP only. And this was 2 players who made the news. That doesn't mean that they were the only players who were treated this
many
week.
more, I'm sure.
I am sure there were. This is this treatment modality is very popular amongst the professional athletes. Remember, they're very restricted. They cannot be used. Many of the substances that are used otherwise to promote healing on the outside because of the restrictions imposed on them with the controlled substances that they cannot use. Considered to be stimulants or not allowed to use them. So
right, it could affect them in other ways.
correct, enhancing treatments.
Their performance, which would give them an unfair
performance-enhancing
advantage.
treatments, correct. When you're using your own cells, I mean, is this your own body healing your own body? And this is they do very well with this.
Yeah. So that's interesting that Kane was treated for a wrist sprain because, normally when we think of a sprain, we think of something that'll heal in, let's say, like a matter of a week or two. But I guess this must have been some sprain. This must have been a pretty severe sprain.
Well, as we mentioned before, we will heal our injuries normally, but there's a process. I mean, there's certain cells that go to the injured area. Once the injury occurs, there's activation of all these factors inside the body. I mean, there's messenger factors, there's growth factors, there's cytokines, and a bunch of different messenger and activating substances that promote the healing. But if there's not enough of these cells that are brought to the healing area, then we can multiply that many times by harvesting cells from somewhere else and bringing them to the injured tissue.
To the injured site. Wow. So interesting. Can you describe the process for us a little bit of stem cell? The harvesting and separating.
Well, yes. We depending on which area is going to be harvested, the most common use is the bone marrow, and the most common area is the pelvis. The pelvic bones are the most rich in stem cells. So bone marrow is harvested from there with a small procedure. After the bone marrow is aspirated, is processed in a lab via centrifuge at specific speeds to try to separate the different cells in that. Now, harvesting is a tricky thing because when you go and harvest bone marrow for bone marrow transplant, for instance, you get bone marrow and you just get it all and transplant it to somebody else. In this case, we don't need all the bone marrow. We want the stem cells, and the stem cells live in certain areas of the bone marrow. So it's tricky where you get them from. How do you harvest them? So one bone marrow aspiration will yield a different amount of stem cells than a different technique of bone marrow aspiration. So you have to make sure that whoever is harvesting your cells is very familiar and very well trained in harvesting those cells from the different areas to obtain the maximum yield of stem cells. So you don't want to have 40 million stem cells when you could be having 100 million stem cells per cc of aspirate.
So in other words, if you go to the pelvic region and you extrapolate some cc's, then you're not just getting stem cells, but you're also getting other types of cells that then have to be separated?
Sure. You're getting red cells, you're getting white cells, you're getting the stem cells, you're getting some chondrocytes, some bone cells as well. So all this needs to be separated and clean, if you will, and from debris, and then processed and injected. Very important as well. I mean, there's other physicians who do this in the area, and it's very important that with the patients go to see somebody who does that and make sure that they are familiar on the harvesting techniques, as well as are they counting the cells. We do count the cells that we are giving back to the patient, so that we're not just giving you the cells. We are telling you, okay, we were able to obtain 100 million cells per cc, or 40 million cells, or 150 million cells per cc. This is important in the results, because the more cells that we deliver to the area, the better the healing and faster recuperation period going to be.
So you don't want to under-deliver the amount of cells. You have to retain a certain cell count. That must be a tedious job, 899,001.
Yes. We have a cell counter. No, I mean there's special techniques for counting cells. I mean we can do it just by looking at a microscope. You have
Wow.
a graded slice where you have the little grays, and you see if you count how many here and multiply for the other. Make sure that the distribution is even. But yes, there are ways of doing it, and yes, it's tedious sometimes.
It's amazing. It's mind blowing. Really an amazing process.
Well, you're going to go through the process. You want to make sure that it's done properly. You know, it's
Yes.
again. I mean, it's one way of doing it. It's not necessarily the only way of doing it. Just to give an idea, when we are using bone marrow, I mean, we will go and reposition our trocar several times. Sometimes it needs to be introduced into the bones 3 or 4 times to.
What was that word? The trocar?
The needle that we use
Oh, the needle? Okay.
To harvest the cells. Yeah, I don't like to say needles sometimes because patients get afraid
Got
of
it.
needles.
But it has, in other words, it has to be placed in just the right position.
Correct. Yes. I mean safety. I mean we have to be sure to make it we're not going to be causing any damage.
Right.
And 2, we want to make sure that we are obtaining the best possible yield and the number of cells.
So how can you tell, like when you put the trocar in, how can you tell if you're extrapolating exactly what you're intending to extrapolate?
Well, we know extrapolate. We're aspirating, and there are areas. The stem cells in bone marrow live very close to the periosteum, which is the outside of the bone. And when we put in a needle through there, it's very hard to get there. If you just aspirate everything from one injection site, the number of cells is going to be a lot less than if we reposition that trocar or actually even do a second injection site.
Interesting.
So those are tricks of the trade to maximize the yield of cells.
Very interesting. Very high tech. Medicine's come a long way.
Actually, that's the mechanical part. So after we have our bone marrow, you know, we take that to the lab. We separate the cells, centrifuge them. Then once we have the cells, we count them, we caress them, we
Massage them.
there you go.
Bring them back into the site.
And once they're ready, they go back into the patient.
Very nice. So, generally speaking, it does take a little while to see the results. So, I assume we're not going to see the results on Kane or Strasberg like most immediately, although maybe perhaps that's what they're hoping.
Again, I mean, we're expediting the healing process. I mean, if some injury will take an athlete, let's say, a week to 10 days to get better, when you using these techniques, you expect, 3 to 5 days. Again, depending on the seriousness of the injury. I mean, some injuries may take longer. It may need to be sidelined for a while until the injury recuperates.
So, what are the injuries that are best treated with stem cell therapy and PRP therapy?
Well, these treatments are amenable to treat any soft tissue. In my practice, as I said before, we concentrate on the musculoskeletal system, and that involves the tendons, the muscles, the cartilage, the bone, and any injury that happens in these areas is amenable to the treatment. And these tissues exist in all our joints. All the muscles go to pretty much and tendons go to every joint. So every joint that has either damaged cartilage from, let's say, osteoarthritis or tendons from ruptures, all these patients are amenable for this treatment.
So, why live in pain? Call now with your questions for Dr. Escobar or to find out if you are indeed a candidate for stem cell treatment. Call 888-565-1470. Again, that's 888-565-1470. You're listening to 1470 AM on your dial. Or you can tune in to WWNNradio.com or AMP2 TV Productions on Facebook.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialist of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairman of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
Love to.
Welcome back. Welcome back to the Regenerative Medicine Show with Dr. Luis Escobar. I'm your host, Tracy Kawa. Thanks for tuning in to 1470 AM on your dial. And you can also catch us on WWNNradio.com or AMP2TV Productions on Facebook. Call in if you have any questions. Why live in pain? Call now today, right now, to see if you're a candidate for stem cell treatment at 888-565-1470. Dr. Escobar, so do you have any interesting cases? I know you can't mention any names, but perhaps an interesting, story or, what somebody might have come in for stem cell treatment for?
Absolutely. I have a very interesting story. A very good friend of mine that we worked for many years. Have not seen her for many years, and came back with severe neck pain. And she's taken a lot of pain medication, and we did a diagnostic injection with steroids in her neck, on the facet joints in her neck, and she got some relief.
Nice.
She was very happy, but the pain came back in a couple of days. So I tell her, how about if we try stem cells? You have diabetes. We don't want to be using stem cell. More steroids, because that how what it does to your blood sugar, and you're already taking all this other medications. So why don't you try the stem cells? She says, okay, I trust you. She says, I worked with you before. I trust you. So I went ahead and did the stem cells on the facet joints in the neck. We did 4 different joints. This is very precise injections under fluoroscopy, and she has done dramatically great.
Wow.
She comes and says to me, Louis, if you can do to my back what you've done to my neck, I'll be a happy person. So we're in the process of getting her to do some treatments in the lower back as well.
Nice. She really likes you. She's on a first-name basis and everything.
I tell you, we worked with her for many years.
Patients become like family. So that's great. So in other words, instead of her living with all of this neck pain and taking additional drugs that she really, or steroids that she doesn't need to be taking because she already has the diabetes, she's dealing with other issues. So that's fantastic. She's doing the stem cells and it's really relieving some pain. So we have a caller. Welcome, Lisa. I believe you have a question for us.
Hello?
Hi, Lisa.
Hi, how are you?
I'm good. How are you?
Good. Thanks for taking my call.
Absolutely.
Doctor, I have a question for Dr. Escobar.
Okay.
Yes, Dr. Escobar, I hurt my back about a year ago moving a bunch of boxes, and I just ended up just with so much pain and having trouble bending over and reaching and picking up for things. And I've gotten a lot of massages, and I've tried to do my stretches, and I ended up going to see a spine doctor who prescribed me some Mobic, which was some form of anti-inflammatory, which helped. And but periodically that back pain keeps coming back. And so I was just wondering if I were to go to a pain management office like yours, are there other things that you would do prior to getting involved in the platelet and the stem cell, or do you go directly into that? I'm just curious how would you approach that type of condition?
Great, Lisa. Thank you for calling. The first thing would be to examine you and look at your radiological studies and try to determine what the exact pain generator is. If you do have only soft tissue like a facet pain or just a sprain, going directly to the stem cells would be a little bit of an overkill. If you do have a herniated disc, we may want to be a little bit more aggressive. Perhaps epidural injections with steroids would be perhaps the first treatment plan, depending on how the symptoms are. If the pain has become chronic, and the more conservative treatments like the therapy and the anti-inflammatories that the spine doctor gave you are not really responding very well to control your symptoms, then the stem cell treatment may be a good option. And again, it may be a good option for the soft tissues, may be a good option for the disc as well. So depending what the pain generator is, once we have identified it, then we can treat it better.
Okay. Well, thank you very much.
Oh, my pleasure.
Thank you for calling in, Lisa. So once again, why live in pain? So Dr. Escobar, before our caller called in, you were saying how you were helping one of your patients, getting them out of pain with stem cell in their neck, and Lisa calling in, of course, and saying about her back and how you can help. So it's more than just the knees, the elbows, the joint. It's your vertebrae. It's your back. It's the center of your being. It's your quality of life.
Any part of your musculoskeletal system is amenable to treatment with stem cells and platelet-rich plasma to regenerate the injuries. So, as I mentioned to our caller, Lisa, and I wish her well, and maybe she can call us in the office. Once we identify the pain generator, we can treat it much better. The algorithm will include the normal treatments.
Perfect. So why live in pain? Call now to find out if you're a candidate for stem cell treatment. Call Dr. Escobar's office. Remember, he's got 3 offices, Hollywood, Aventura, and Pembroke Pines. Call him at 954-322-8586. Again, 954-322-8586. Thank you for listening to 1470 AM. This is the Regenerative Medicine Show with Dr. Luis Escobar. See you next week.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station,